I thank the organizers for giving me this opportunity to talk to you on transform, reform, and perform. I'm going to actually add a completely new dimension to this whole thing, as in I'm going to talk about actual physical delivery of healthcare in our country as it stands, what is the ideal scenario, and how we should position ourselves to achieve it. And I'm not going to delve too much into IT. I am a practicing orthopedic surgeon and have also started daycare surgical units in India for the first time on a corporate level. So I'm going to actually add this new dimension to it. Let me give you some startling figures which we face in our country. I mean, you're all aware that we have a population of 1.1 billion. By 2050, this is going to become 1.6 billion. So what is our aim? You know, it is to provide healthcare, not only healthcare, but quality and affordable healthcare to every single individual of our country. Today we have 1.5 beds per 1,000 individuals. It's far below even developing countries. We have one operating theatre for 1 lakh population. We have 6 physicians for every 10,000. How many of you in this audience know what to do when you have a medical problem? There is no direction. For most of us in the cities, you know, you just walk into an Apollo or any other hospital, you know that you have a good chance of finding a good physician or a surgeon to get your health care. But for most of the people who live in towns and in villages, they don't know what to do at all. The government provides about 16% of healthcare. 80% is by the private sector. 77% of our population has out-of-pocket expenses for healthcare. Most families who we come across in orthopedics after a trauma are bankrupt by the time they settle the hospital bills to get one of their family members back on their feet. So this is where we stand. 1% of our population has private insurance. 1% has social insurance like your Rajiv Gandhi Yojana and Arogya Bhagya schemes and Yashaswini, whatever. You heard in the earlier session Miles Ailing from the NHS talking to us about an ailing NHS system. They are spending 165 billion pounds per year on healthcare. The size of their country is the size of our state, and the population is so much lower. We are spending $36 billion every year. That's a 1/5 for such a big population. So as our population grows, where are we headed? So the way forward is to have every single individual in our country to come under some form of insurance, which means they keep away a part of their earning every day. It might be as low as 5 rupees per individual within the family. Keep it aside for your health. Let some, insurance provider take that as a premium and provide, health care for you. If 1 billion people are insured, the insurance providers will even pay for outpatient services, for investigations, in which case your big hospital chains, the Apollos, Fortises, will go to every nook and corner of the country and establish their clinics, next level of, smaller 20, 30 bedded hospitals in towns, the next level in the cities, the bigger tertiary referral centers. So this is where we need to direct ourselves. Most like Miles Ailing said, the system there is struggling. How much money are you going to keep pouring in? So what I feel is the government, instead of spending and too much of their time and energy and money in providing health care, they should facilitate a system where every single individual gets insured. A couple of months back, 4 million middle-grade entrepreneurs got a letter through their door from Obama saying that health insurance for their employees is subsidized, and they are all forced to, register towards that. So everybody, there is a system where everybody gets insurance. Coming more specifically into a small way in which we are trying to contribute towards bettering the quality of healthcare is surgical units. About 30 years ago in the US, 5-6 surgeons got together and said, the waiting times in hospitals for small surgeries is too long. Patients are paying, quite a bit because the infrastructure to build these hospitals is quite large. The money spent on building these hospitals is huge, so, they employ more staff, so the output from every patient for a small surgery is quite big. So they started their small daycare surgery units. It takes about 4 to 5 months to put one. We've started a couple of them so far. We've done over 1,000 surgeries. And we feel over there in the US today, 70% are being done as daycare. And in India, only 20%, most of them off-style. So going forward, if we have multiple centers where every village has a clinic, next level surgical center, come clinic where both medical and surgical problems can be treated, and then finally a tertiary referral system. So when we reach our 1.5 billion population by 2050, if we want to be a developed nation at that time and provide quality healthcare to our next generation, I think we should start acting now. And with everybody coming together, I'm sure it is a possibility. Thank you.